Gentlemen, I'm Vaughn Stinson with the Maine Tourism Association. Our other co-host this morning, Curtis Picard, who's the Chief Executive Officer and President of the Maine Merchants Association, will be along a little bit later this morning. I'm sure that all of you are sitting on the edge of your seats with this really exciting topic we have this morning, because the more I dig into it, the more I know that I don't know about it. And my association has 50 full-time and part-time employees, and many of you have more than that. Some of you may have less than that, but this Affordable Care Act is going to affect all of us in the business world in ways that I think we never even thought about before. So what we're trying to do, and our attempt here, is to give you a little bit of insight on it. There's been some others, association groups that are doing the same type of thing, so hopefully through an educational process we'll be able to enlighten everyone and offer you a few more details as this comes down the line, because as I said, it's confusing at best. Before I introduce our opening speaker, Joel Allumbaugh, there was back in June there was an editorial that he did, and looking through some of the things, and Joel has a great background in medical and in insurance. We've worked with him in our association for over 8 years on different insurance items for our employees. But there was a quote in there: health insurance reform is difficult and complicated issue, and it can be challenging to make an exact comparison between plans, since cost and coverage vary greatly. And that is probably an understatement in all of it. We have Joel here this morning. Joel is the CEO of the National Worksite Benefit Group. He has been working with another group called Maine Sense. We have a couple folks here this morning, Mark Bancroft of Bancroft Contracting, which will join us here shortly, and then Art Batson of Lucas Tree Service will be here this morning to kind of speak directly to some of the things that they've already encountered. Joel will start off with a PowerPoint. We'll have plenty of time for Q&A, so you may want to take notes as we go through it with anything that comes up we cover. So at this point, why not turn it over to Joel?
Thank you, Mark.
Thank you, Joel.
Well, good morning.
Morning.
That quote made me sound pretty articulate. That was kind of nice. I really remember writing that. Well, thank you for coming in. I know I caught the sarcasm with Vaughn. This is a really, really exciting topic, so I know you're all dying to hear about the Affordable Care Act. It's, you know, this law has basically been consuming people like me and you know, other people in the industry, Pam here as well, for a number of years now. When it was first being debated down in Washington, I was serving at the time as the president of the Maine Association of Health Underwriters, which is really just a association of brokers and folks in my profession. But basically was involved with, you know, discussions and going down to DC and trying to basically understand what was happening with this law and how it was going to impact really our clients, which is primarily employers. And then since then, you may also be aware that there have been reform laws passed here in Maine as well. So in 2011, there was a reform law passed that was pretty significant. I had worked on that particular piece of legislation, and then have been serving as the Director of the Center for Health Reform Initiatives at the Maine Heritage Policy Center for the last year or so as well. So I say that just to point out that I sort of intersect with this law from a number of different angles on a day-to-day basis, but when it really boils down to it, what I have to deal with is what you have to deal with, which is figuring out how does it impact your plan, what kind of decisions do you need to make, etc. And we've been trying, and I emphasize trying, you know, to really make sure we understand the specific provisions and how it's gonna impact your plan. I say trying because you need to keep in perspective that this law is over 3,000 pages. And I don't know if anyone here has ever read a piece of legislation, but it doesn't exactly read like a Dr. Seuss novel, or, you know, maybe it does actually. But it's, you know, if there's 3,000 pages, there's all kinds of references to this statute, that statute. And if you really wanted to dig in and try to get your arms around it, you'd probably be to read 3,000 and really understand it. Well, you may never understand it, but, you know, that might mean reading, you know, 5,000, 6,000, 7,000 pages, and then we're talking about literally the regulations associated with this law will likely measure in the hundreds of thousands of pages. We've had several thousand that have come out already. To give you just one example, there is a provision which I'll talk about in a few minutes called a summary benefit comparison. And the feds basically said, look, insurance is really confusing. We want you to provide benefit summaries to people who join these programs that are understandable. And they sort of set their own standard format for these benefit summaries. You're probably hearing about them now. If you're not, you're going to at your next renewal. And they said, look, we want these to be plain language. We want people to be able to understand them. We don't want them to be any more than 4 pages, no smaller than 12-point font. And they actually then released regulations a number of months ago to sort of give guidance to employers and insurance companies about how to, format these 4-page summaries. Anyone want to take a stab at how many pages of regulations we needed to tell us how to put a 4-page summary together? Over 150. Just to give you a little perspective. There's a lot of stuff in the law that really impacts the insurance market in general, but I'll tell you that the bulk of this law, I would say 99% of it, doesn't really deal with health care directly. It deals with health insurance. And I think that's why employers need to be attentive to the different provisions, because it really impacts your plans, not so much the services you get at the hospital, although I think there certainly are a lot of ripple effects. And there are obviously responsibilities for employers, and there are responsibilities for employees as well. So I'm going to go through just a few of the highlights that we're dealing with right now, and trying to focus a little bit more on the here and now. As you also may be aware, this is an absolute moving target. I had done a presentation at the HR convention up at the Samoset. It was about a year following the passing of the bill. And I had literally a whole slide that was just provisions of the law that were already supposed to have taken effect that had either been changed or delayed or repealed, etc. So it's really been moving quite substantially. And as you may be aware, I don't know if you've caught this on the news, but there's an election coming, and everything could change yet again. I think realistically everything's going to change regardless of who wins, because in one equation, if we have a new president, then there's probably a lot of likelihood that this law is going to go away, or at least be modified pretty substantially. If we have the same president, I think that we're going to actually really get into the meat of the implementation and really run into those areas where the intentions and practical reality clash, and again, the law is probably going to have to adjust and change to make it functionable as you try to start using those different provisions. So a couple things that are sort of coming immediately. One is the flexible spending accounts. I'm going to get to a slide in a minute that sort of talks about some of the things that we've been focusing on for 213 for the renewals that you're dealing with right now. But we do have the flexible spending account contribution limit that's coming in. There are a number of ways in which this law raises money. So as you think about this law, on one end, they want to cover more people, right? So we're gonna all these people that are uninsured in the country, we're going to try to get more of them on insurance programs. Some of the ways we do that is we try to expand Medicaid. Some of the ways we do that, we require employers to offer coverage and give you a number of parameters. Some of the ways we do that, we require individuals to buy insurance, or we face penalties. But obviously, if you're going to put more people into the insurance rolls, you've got to pay for it. So the single biggest funding for this program is money from Medicare. So when you hear a lot of this in the news right now, where they say 700 and some odd billion coming out of Medicare to pay for this law, that is the biggest single funder. But there's a bunch of other stuff. Some of it is limiting tax deductions, and the flexible spending account is one example. For those of you that have those in the past, employers determined how much an employee could set aside in a flexible spending account. Moving forward, there's a limit for what an individual can put into their own FSA of $2,500. There are a number of new taxes that are starting to come in. I don't think you're going to see this as a line item on your insurance renewals, but trust me, it's in there, and it's certainly baked into those rates. We have the preventive care covered without a copay that came in right away. We had the no lifetime maximums come in right away. That probably added a couple of percentage points to your insurance premiums. Most recently, we had the expansion of the definition of preventive care for women's health, so the whole debate around contraceptives being covered without a copay. That's just coming in now. So that'll be rolling in on your next renewals. That took effect September, so it applies to your plan at the next renewal. Again, not a big impact on your rates, but these things cumulatively will certainly be adding up. There are some taxes for a number of different things. There were 3 specific ones. If everyone familiar with who the CBO is, Congressional Budget Office? So Congress, they write up a bill, it goes over to the CBO, they price it. They're the ones who say, here's how much this thing is going to cost. Now, you ought to have a little bit of perspective on this. They don't always get it right. In fact, with Medicare, they got it wrong by about 800% or so. So the CBO is not, I don't think I'd put them in the same category as your accountant if you go with them with a business plan. They only look out 10 years. And year 11 essentially doesn't exist in the CBO analysis. And they are also required to use the assumptions that Congress tells them to use. I've been trying to do that with my accountant for quite some time, and it hasn't worked just yet. But so I just want to put that out there, that the CBO is not always completely accurate. But there are 3 revenue raisers: medical device manufacturer tax, tax on pharmaceutical companies, and tax on insurance companies that the CBO said were likely to be passed on to consumers. Those taxes really start to take effect in 2014. And what I typically see when a tax is coming, we usually start to see some preparation for that in the year prior. So I think you may be starting to see some of that roll into your insurance rates where they're getting ready. Because it's not you directly that pay them, the pharmaceutical companies pay them, the medical device manufacturers pay them, the insurance companies pay them. But you may have learned over the years that insurance companies, companies in general, generally don't like to spend money. They like to collect it from you and then spend the money, and that's realistically what's going to be happening. I would point out that the tax on insurance companies, Forbes actually did an analysis on this shortly after, it might have even been before the law was passed. And the objective was there were a lot of for-profit health insurance companies in the country, and there was a perception that they're earning too much money, and we want to get that back out to consumers. So that's what this tax was, and it's a dollar amount. They said, okay, it's going to be, I believe it would raise $8 billion the first year, and then it sort of ratchets up from there. Forbes did an analysis and determined that the amount of money that they're raising through that tax on for-profit health insurers is larger than the aggregate profits of every for-profit health insurance company in the country. So it's inevitable that it'll eventually hit our insurance premiums. So as you sort of come into this 2013 renewal, and even your renewals, that are coming in this fall, you're starting to really get into 2013. So most of them from this point forward, you are going to obviously have to deal with the flexible spending account piece that I talked about. You end up modifying your plans if they're in excess. There is the reporting requirement on the W-2s. This is another one where when the guidance came out, this was actually somewhat helpful guidance. And what it basically said, there were a number of ways in which this wouldn't necessarily apply to you. And the biggest threshold that I think is important to know is that you're not required to do this unless you issue 250 or more W-2s. So if you're smaller than that, you're off the hook for the time being. The way the regulations were worded is interim guidance. It basically said until you receive further guidance. So sometimes they just push it out and say, here's the new effective date. But in this case, they said until you hear otherwise, 250, 249 or less, and you don't have to do the W-2 requirements. For those of you that do have to comply with that, that has to happen now. So for the W-2s that you issue at the end of this year for 2012, value of your health insurance plan needs to be on there. That's the full premium, by the way. So if you pay a portion as an employer, the employee pays a portion, it's the combined number that needs to be on there. And if you're self-funded, then there's a number of different ways you can sort of calculate what is that number. probably the simplest way is to use your COBRA rates. It's not taxable at this point. So I would throw that out there as well. I can envision employees suddenly seeing several $1,000s on their W-2s for what their health insurance plan costs and wondering, okay, am I now being taxed on that? A lot of people have said to me, well, if it's on there, it's not going to take them much to make that a taxable expense. Fair argument, but as of now. So the other one is a summary of benefits. Anyone in the room use an HRA in their health insurance plan? Okay, so a number. So I was doing a talk for the Maine Bar Association a couple weeks ago, and I was on a panel, and one of the attorneys, an ERISA attorney, took quite a bit of time to talk just about this summary benefit comparison. And they actually have, they've given a little bit of flexibility. They said that the 4 pages can be 4 pages two-sided. So they figured out pretty quickly, I guess, that it's pretty difficult to cram all that information in 4 pages. They actually give you a fair amount of flexibility. The templates that they give you to work from for these are in shades of blue. And they actually, in the guidance, said, if you like, feel free to use shades of gray. So there's a lot of flexibility on those forms. You can use any font you want as long as it's not smaller than 12 point. It's one of the more detailed pieces of regulations that I've seen yet. What's interesting about those is that if you have an HRA, and let's say your HRA, for those that may not be familiar, a health reimbursement account, basically a tax vehicle that enables you as an employer to fund or reimburse some of your employees' out-of-pocket costs. A lot of employers nowadays have those where they use a higher deductible health insurance plan, but they pay some of it on behalf of their employees. Well, those summary benefit comparisons, they need to reflect that HRA. It has to be on there. Well, the insurance companies, generally speaking, are producing these on your behalf. Here's the challenge. I was listening to a webinar yesterday, one of the insurance companies talking about their summary benefit comparisons, and I actually had someone in my office listening to most of it while I was in some meetings, and I said, listen, there's a key question I need to know. When they produce these, find out if they're PDFs or if they're editable documents. And the reason I wanted to know was because they're not putting the HRA information on there. That's, they're putting their information for their insurance plan, which means, as an employer, you're required to modify them. Well, in my business, I know that the employers we work with are not going to spend any time modifying them. They're going to call us and say, can you modify this and put our HRA, make sure it's reflected on there. So my first question was, okay, you're going to produce them. Are they in a format I can actually modify them? Can I get in there? Then the next piece comes out. I mean, I'm not a real technical guy. I get made fun of a lot in my office because they say I'm young enough or I should be more technologically advanced. I have a 14-year-old, about to be 15-year-old, who had to show me how to text on my phone, if anyone can relate. So, I was starting to picture this and say, okay, well, this is a very specific form. The formatting's very specific. You can't mess with it. So if I go in there and I start to type to reflect that there's an HRA in there, I got to figure out where. Well, what happens if I start typing and all of a sudden it shifts and I go on to the 5th page? I'm suddenly out of compliance. So this is an interesting one. These take effect September 23rd, so it'd be for your next renewal following. We're working now to try to figure out how those mechanics are going to work so that we can give some guidance. But I just want to throw that out there. If you're getting one from your insurance company and it reflects your insurance benefits, but you've got an HRA, it's not complete. And you are not allowed to have a standalone HRA summary benefit comparison if it's specifically tied to your medical plan, to cover out-of-pocket costs in that program. It's got to be on the same form according to the guidance. There's a whole bunch of regulations on that one. I'd be happy to share them if you're interested in navigating that one. Another one is the grandfather plan. So a lot of the provisions in this act don't apply if your plan is grandfather. You remember them saying if you like your plan, you can keep it? I think that was kind of true. What they said was, if you like your plan, you can keep it. Well, the plan you had the day this law was signed, which was March 17th, whatever that plan was, you couldn't change it. That was your opportunity to grandfather your plan. And it was very restrictive in terms of what you could change. You could make some minor benefit modifications. When I say minor, I mean really minor. I'm pulling from memory, but I think you could change a deductible by 15%. So let's say you had a $1,000 deductible plan. That means you could go up to $1,150. Anyone ever seen an $1,150 deductible? You also could change your contributions with your employees, but again, within very minimal parameters. So what most companies, year one, lost their grandfathered status. In some cases, the insurance companies took that decision away from you. They just said, hey, we're not going to offer grandfathered plans administratively. It's too difficult to try to manage both. That was unfortunate in the sense that you didn't have the choice. Fortunate in the sense you didn't have to spend a lot of time debating the decision. And then other employers, you had that choice to make, but I don't know if anyone can kind of go back to the year the law was passed, not that it's all that different today, but I remember looking at renewals right after the law was passed, and I bet our average renewal for the small businesses in Maine was about a 30% increase that year. So in most cases, once that increase came, I mean, your employers, you know what happens. You modify your plan, you move to higher deductibles, you change things to not eat a 30% increase. So many of those employers, that's what they did. They didn't have the option to not change their benefits or not change their contributions with their employees. So I think in most cases, the grandfather decision is made. A lot of people are just sort of trying to look ahead to 2014. What do I got to do? I'm going to talk a little bit about some of the ramifications in 2014, but it's difficult. You can't really sit here today and have complete clarity on what you need to do in preparation for 2014 because it's a moving target. And there are many, many, many regulations yet to be written. I did want to point out, as I mentioned, there was a reform law passed in Maine. When that reform law was passed, which was just back in 2011, there were, Maine was one of 4 states that was more restrictive than what the Affordable Care Act was doing to the country. So when you think of the Affordable Care Act, there's new regulations, new rules, new requirements. There's a lot of new things that impact Maine just like everywhere else. But when it came to the insurance rating rules, we were, generally speaking, more restrictive than what the law was asking us to get to. And so Maine actually made some changes in their healthcare rating rules and a few other things in 2011, sort of shifting a little bit, but still staying within the parameters of the Affordable Care Act. And there are just a couple of interesting points I want to mention. One, you may not be aware, but Maine had a state law that said you could not, as an insurance company, offer an HMO that had greater than a $1,000 deductible. So if you wonder why, as you get your insurance options each year, you never see an HMO with a deductible over $1,000, that was why. It's literally a state law. So years ago, we were primarily enrolled in HMO plans. As the rates went up, and people started shifting deductibles to get to more affordable premiums, they ended up moving over to PPOs because they could go further up the deductible ladder. And that's what sort of happened from a practical standpoint. Well, now the HMOs can offer higher deductibles, and every carrier that offers in Maine has already done it. So we've seen a lot of that over the course of the last year, where when you get your renewals, you see the different options you have for plan choices, a lot of new HMO programs with higher deductibles. And some pretty good pricing points on some of those, so they're worth looking at. They've also established the first Health Insurance Association captive, and that's really what MaineSense is, which the gentleman over here will talk about in a little bit. But it was sort of an opportunity for employers to create their own self-funded model to sort of band together to manage their health insurance costs. That's a new program that was available as the result of law change here in Maine. And it's, by the way, the first one in the country. They also made some changes to the individual market. So if you have to buy insurance, you don't have access through an employer, but you got to go get it on your own. They made some pretty substantial changes to the individual insurance laws. Maine, by the way, has some of the highest rates in the country. I probably don't have to tell you that. And if you think group rates are bad, look at individual insurance rates. They'll make your group rates look a little bit better. They established a reinsurance pool, did a couple different things, but the real translation of that, or the result of that, has been, again, a number of new products available to people and some much lower price points. We saw products with rates as much as 60+% lower than what sort of the most equivalent policy prior to those law changes would have been. So big, big difference for individual plans. For groups, there are a lot of really small companies that work hard to make sure they have group insurance plans. I know a number of sole proprietors, they'll come to guys like me and say, hey, help me be a company for the sake of buying their insurance because they have more options and generally a little bit better pricing. But I think if you're a really small company, what we would call a micro company, maybe somewhere between 1 and 5 employees on your plan, it probably makes sense at your renewals not just to be looking at your group options, but also individual options. And I know that that's been a pretty attractive choice for people. There is continued rate pressure, and I just want to point this out. There's been, I had mentioned in an article in the Bangor Daily News yesterday, wasn't really flattering, but had mentioned, and it was talking about, as this law was passed in Maine, there was a lot of talk about rates coming down. And there's a study that was just done there sort of pointing out, hey, 90% of small businesses are seeing rates increase as a result of the law changes in Maine. That's not really true. It's true that 90% of small businesses are seeing their rates go up at their renewal. What's not true is that it's as a result of the laws that happened last year in Maine. Because the reality is, if you go back the last several years, it's been about 97% of small businesses that see their rates go up. Rates going up is not a new phenomenon for us. We've been living in that environment for a long time. What is a story is that we went from 3% of small groups actually seeing rates go down at renewal to over 10% actually seeing rates go down. That's a pretty big movement. But point is, we are still seeing the lion's share of companies see their rates go up. This is interesting and notable as you start to come into the Affordable Care Act, because there are a lot of requirements as to what your plan needs to look like under the Affordable Care Act. For many of us, that's going to mean turning in our higher deductible policies and having to purchase lower deductible, higher cost policies to meet the minimum benefit standards. And I just think that's interesting for people to be aware of, because we're still seeing people moving to higher and higher deductibles to get to price points for the simple reason that their rates keep going up. And that's going to keep happening until medical costs cost less. And there's, as I said, the law doesn't really address that. It addresses insurance regulations. So I want to talk a little bit about what you have to think about as an employer. One of the things that happens, there are some decisions that you make as an employer that you no longer get to make or are going to be made for you. The flexible spending account limits was one example of that. Another one is your elimination period. How many people in this room have an elimination period for a new employee coming into your company to join your health insurance plan that is greater than 90 days? How about greater than 60? Okay. So, this is something that employers make decisions on. They dictate what the waiting period is going to be. And what you usually do is you look and you figure out, well, when new people come on, how much turnover do we have in the first so many months? When is a reasonable time when we know that a new hire is going to stick with us? They're going to be here and we want to, extend that benefit. Well, as of 2014, the ACA says you cannot have a waiting period in excess of 90 days. The regulations just came out for that. I believe it was last week. And the way that it's worded, what it really means to me, most plans for waiting periods either say, okay, a new hire is eligible the first of the month following, 30 days, 60 days, 90 days. To meet this 90-day requirement, you will not be able to have a waiting period in excess of the first of the month following 60 days. You also, anyone define a full-time employee as, let's say, 32 hours or greater per week on average? Some. You're not going to be able to do that either. So full-time is defined as 30 hours or more. So this is important for some employers to be thinking about, because it could mean that you have people eligible either sooner or populations that are working for you eligible that you wouldn't necessarily have considered eligible otherwise. The big one that I think people need to be thinking about is this whole employer mandate. And I want to spend a few minutes on this. So the employer mandate says if you're an employer and you employ 50 or more employees, you got to offer coverage. So it's individuals have to have coverage. Employers are required to offer coverage only at that threshold of employees. If you have 10 people in your operation, you're not required to offer health insurance coverage under this law. There's no requirement. It's your choice. But if it's 50 or above, you are required, or more specifically, there are ramifications for not, or even for offering the coverage. The confusion is in how do I know if I'm 50? Because I have to look at my full-time employees. I have to use the definition I just described to figure out how many full-timers I have. I then have to look at part-time equivalents. And I'm waiting on more guidance on this one, but my interpretation as for the information we have would be, okay, I have 2 part-time employees that work 15 hours a week on average, that makes 1 full-timer. I don't have to offer them coverage, but they go into the calculation to determine, am I a 50-plus employer or not? And the big one, I think, is specifically for the hospitality industry, is the whole issue of seasonal employees. Because what the law basically says is that if you're seasonal employees, you can exclude them from the count in determining if you're a 50-plus employer unless they work more than 120 days a year. Now, I know in the hospitality industry in Maine, most seasons extend beyond 4 months, so there's a likelihood that a lot of employers could have to count these seasonal employees. Well, this guidance I'm holding up here, if anyone's really interested in some excellent reading material, I've got some for you. This just came out, it was either earlier this week or the end of last week. Just talking to Pam about this before we got up here. I've read through this multiple times now, and I don't have complete clarity. But what it does is it creates some safe harbors that basically enable you, give you an opportunity to sort of do a look-back period. So if someone comes in, you don't know what their hours are going to be. They're variable, let's say. That you can give it a certain amount of time, let it play out, then calculate, okay, how many hours did they actually work? Then you've determined whether they're full-time or part-time, or seasonal or not seasonal. And then you have to have what they call a stability period. So if you've determined, based on that look back, that they're, let's say, 30 hours on average, so they're in that full-time category, no matter what happens next, you've got at least for a certain period of time, that's how they got to be treated. And then there's a little bit different provisions for if, it's someone who's been an existing employee or whether it's somebody who's a new employee. Your look-back period can be different time frames. You set them as the employer, but can be up to a year. So if I have seasonal employees, I can tell you I'm going right to the year. How this is going to impact, what if you have seasonal employees that come back each year? I mean, there's a lot of questions after reading this, and I just want to give you a sense of this. As I was reading this and really trying to understand, I was really thinking of this morning, to be able to explain this with some clarity. But I just wanted I want you to understand the pain a little bit. Tell me if this paragraph makes sense to you. Once a new employee who has been employed for an initial measurement period has been employed for an entire standard measurement period, the employee must be tested for full-time status, beginning with that standard measurement period, at the same time and under the same conditions as other ongoing employees. Accordingly, for an example, an employer with a calendar year standard measurement period that also uses a 1-year initial measurement period, beginning on the employee's start date, would test a new variable hour employee whose start date is February 12th for full-time status, first based on the initial measurement period, February 12th through February 11th of the following year, and again based on the calendar year standard measurement period. If the employee continues in employment for that entire standard measurement period beginning on January 1st of the year after the start date.
You lost me.
Makes sense.
Okay, just want to make sure everyone was with me on that. So as you can see, it's pretty clear, and you should have no problem determining whether your seasonal employees are part of the count or not. There's pages of that, and that's literally what the whole thing is like. So it's going to take, I've gotten as far as I can. I now need to go to the attorneys and say, okay, help me identify this. So keep that in mind. Somewhere along the line, be prepared to speak to the attorney. Yes?
Is it all right if I ask a question?
Yeah.
The first line under 2014 refers to the waiting period, and it seems quite clear that 90 days is 3 months. You mentioned that, and that would be, you hired them, they may not have worked 90 days, the period is 90 days.
Correct.
Then the last, in that same area under the second bullet point, there's a line that says employees enrolled unless they worked more than 120 days. Is there a little space in there where if somebody's working 6 days a week for 4 weeks, that's really only 24 days? It's not 30-day period? Are they days worked or the period?
Yes.
So, perfectly clear.
I mean, the 90 days is just the 90 days refers to what is your eligibility for a new hire coming on to join your program that you know is eligible. You know they're a full-time employee. The latter bullet is really talking about, do I got to count seasonal employees or not in that mix? And that's where there's some different definitions. And this whole guidance is supposed to help you understand how to do that, how to measure, when do you start looking? Because a seasonal employee you may not know, or maybe a variable hour employee, you may not know the day you hire them what their average hours are going to be. You probably know on a seasonal employee if they're going to work more than 120 days, but you may not necessarily know if they're going to average 30 hours over the course of the year. And so this is supposed to give you guidance on that. I wish I could give you a clearer answer, but I got to tell you, reading through this multiple times, I'm not there yet. There'll probably be some more regulations to tell me how to read these regulations, so that'll actually be helpful when we have those. So let me just talk about the ramifications. So let's assume you may be an employer that you know you have more than 50 employees. That's easy. So at least you know I'm in this category, I got to deal with it, or I'm going to not deal with it. What I just want to point out to you with the first part of that slide is just if you think that you are not a 50-plus employer, but you do staff up with part-timers or with seasonal employees, don't assume that you're not a 50-plus employer, because you may be by the time you go through the way they want you to calculate that. So don't make an assumption on that one. Let's just say that I am 50-plus, I know that, I'm required to offer coverage. But I choose not to. So I'm not offering benefits. And you do have that right, you can do that. But here's what happens. If all it takes is one of your employees, if just one of them goes into these exchanges, you've heard the term exchange? Exchange is sort of if the law is intended to cover more people, the exchanges are sort of the architecture of the law. This is where individual subsidies get handed out. This is where most of the regulations on insurance companies and employers are enforced. It's all sort of through these exchanges. Well, the exchange, if an employee goes and they qualify for a subsidized policy, you qualify for a subsidy up to 400% of the federal poverty limit. I have 2 kids, so we're a family of 4. That is over $90,000 a year income. If our income is anything shy of that, we qualify for some level of subsidy. My point is, a lot of people will qualify for some level of subsidy. If that happens, it only takes one of your employees. They come back to you, the employer, they exclude the first 30 employees, and then they fine you $2,000 per head for every other employee you have. So it's not an insignificant fine depending on the size of your workforce. It's just the point I'm trying to make if you choose not to offer coverage. Now, some employers have already done the math on this and said, hey, I'm offering coverage right now, and it's already costing me more than $2,000 a head, so this is actually a savings for me. It might be in my best interest just to stop offering coverage and pay the fine. I think that will happen. I think there are some employers that will absolutely take that route. My caution is, how long do you think it'll take before the feds figure out that that's happening, don't want it to happen, and say, geez, maybe that fine should be $4,000, not $2,000, or $5,000, not $2,000. And so we'll see. We'll see what happens with that. Let's assume for a second that you're a 50-plus employer and you do offer coverage. You're still not out of the woods in the sense that you still have some things to be thinking about. Because there are a bunch of fines potentially for offering coverage. If the Supreme Court decision came out, a few weeks ago, and if you were to read the decision, it doesn't say every individual has to buy health insurance. What it says is every individual has to have minimum essential coverage. So if I'm going to tell you that you have to buy health insurance, I then got to define it. What if I say, hey, I got an accident policy, it just covers me if I get hit by a bus. Does that count? Am I good, or do I still get penalized? Well, they define, what do we mean by minimum essential coverage? And there's a few things that go into that definition. There are essential health benefits. So these categories of things that have to be in a program. The thought initially was that what that would essentially do is that the feds would sort of establish, look, here's the floor for these plans. And then, right now insurance is regulated at the state level, so there's a lot of differences from state to state. So the assumption was, okay, well, they're going to sort of have a standardized floor for coverage nationwide. Well, when the regulations came out for minimum essential coverage, that's not at all what happened. What actually happened was they went to the states and said, you determine what minimum essential benefits is for your state. And they give you a couple of choices. The choice that is the default, and also most likely the choice that the state would make, I'm 99% sure this is what it will be in the state of Maine, is the small group product that has the highest enrollment as of now in Maine. Insurance regulated at the state level, there's different mandates, right? There's requirements, we got to cover certain things in our insurance plans. On average, states have about 30 mandates or requirements. You got to have this in the plan, you got to cover this, etc. Maine has closer to 60. We're locked in, is my point. We're locked into whatever those mandated coverages are because of the way they've defined essential benefits. They also have something called a minimum actuarial value. This is where they basically say, okay, that coverage, what percentage of someone's out-of-pocket expenses for medical services would it cover? And the minimum needs to be 60% to pass muster. This is why I say the higher deductible policies are likely to go away because they won't meet those standards. WellPoint's the parent company of Anthem. They did some analysis on this early on and determined that in their individual market, for example, in Maine, the most common deductible level sold in Maine right now for individual coverage is a $15,000 deductible. That's the most common. The average deductible sold in Maine for individuals is over $7,000. The most a deductible could be based on their assumption. There's not a calculation yet to measure this actuarial value. That will come in more regulations. But their best guess was that the highest deductible they could offer post-2014 was $2,250 deductible, I believe. And they determined, by the way, that the cost difference between that deductible and the $15,000 was over 160%. So as you look at your sort of list of benefits and plans you can choose from, I think the list will get shorter, and I think the ones that are no longer on the list are not going to be the most expensive ones. It's going to be the least expensive ones. So, point being, 2014, 50 plus, first thing you're going to have to do is determine, does your plan meet the minimum essential qualifications, and if it doesn't, you're going to have to make the modifications so that it does. So it may get more expensive out of the gates. Likely, I think, will get more expensive for many employers right out of the gates. The next thing that you have to do is you also have to make sure that your plan is affordable to your employees, and that word is specifically in the law. And the way they define that, they say, okay, the amount that the employees pay toward the premium cannot exceed 9.5% of their family income. I'm going to just blow right past the fact that you have no idea what your employee's family income is, nor can you really find out.
IRS ruled, I think, last week that has to say individual income.
Well, what they've said is that since you won't know, you can go by what's on their W-2. So at least you don't have to figure that out. However, here's the ramifications of not really knowing. When they go in to get a subsidized plan, it still goes by their family income. So from your perspective of determining, hey, am I making this thing affordable or not, you can use that as your benchmark. But here's what happens. And by the way, just do the math on that. You've got to cover a good portion of this premium. It may be more than you're covering today on behalf of your employees. So let's say that you have an employee, you're offering coverage, but it's not meeting minimum standards in some form or fashion. Either it's not meeting it's not meeting the affordability standards for me, etc. I then, as one of your employees, I go to the exchange and I qualify for a subsidized policy. Again, pretty easy to get those subsidized plans. Then they come back. There's actually there's two measurements, and it's the greater of or the lesser of. I can't remember, but the one I remember most clearly, it's either so much per employee or $3,000 per employee that happens to. So it's just my only point again in saying this is that if you are going to offer coverage, it's not just as simple as saying, well, we're offering coverage, we're all set. You got a few things that you got to figure out to make sure that you're sort of following the rules as they define them. So this is just kind of an interesting note. You remember them talking about the Cadillac tax? So if you have a plan that's really expensive, that you actually could pay, you would have to pay some taxes on that. Think about that as an employer. You know, to me, you sort of have a chute you got to go between, right? You got to meet the minimum standard, so you got to make sure you're above the floor, but you also got to be cautious. You can't get too crazy because if you got to watch out for that ceiling too. Because the tax is not insignificant. Now, the good thing about the Cadillac tax is that it is so unpopular in Congress that as they wrestled with that one, they ended up pushing the effective date, you'll see, to 2018. Spent a little bit of time around politicians in the last few years, and what that really means to me is they want someone else to take the heat for that one. So we'll put that one out there. You know, probably someone else will be sitting here in my seat. Which tells me that's a likely one to change as we get closer to 2018. It's a concerning one in its current form just because of Maine's cost basis. It's the same all the way around the country. Well, if our cost basis starts here compared to everyone else, we're going to have a disproportionate number of businesses that actually get hit by that Cadillac tax. So we'll see where that comes from. I think the more troubling part of that particular provision isn't so much the tax itself, it's the reporting side of it, because it's complicated. But what they do, let's say that the number, and I'll have to refresh my memory, 10,200. They count a lot of stuff toward that 10,200. It's not just your health insurance plan, it's your HRA, it's your employer HSA contributions, I say likely. It's your FSA contributions, whether it's coming from the employee or the employee. Anyone offer voluntary benefits, dental plans, vision plans, accident coverages, those types of things, if those are being deducted with pre-tax dollars, those count. And what you do, let's say you add all that up and it adds up to $11,000 in total benefit costs. Well, 800 of it is over the threshold. You got to pay 40% excise tax on the difference. But you don't just pay that. Who actually pays it is the different vendors. So it's the carrier that administers the dental plan. It's the carrier that administers the accident policy. It's the administrator that deals with your flexible spending account. And they have to do it proportionally. So of the $11,000, what proportion of that does the flexible spending account cost represent? So my point is, you as an employer have to report all that stuff to those vendors, who I'm quite certain are going to, get it from you in some form or fashion, and then they're the ones who actually have to turn around and pay that tax. So there's a lot of stuff in there around the regulations. I was on a panel on this a while ago for MPBN, and there was an attorney with me, and he said, I was just making the point that these regulations do have a cost impact for businesses. It's not like you just, here they are, you take a look at them for 3 seconds and off you go. I mean, you got to put some time and energy into these things. And it takes time, it takes money. You're going to spend money on brokers and accountants and attorneys and all those things, making sure you're compliant in the end. And I was just making the point that there is a cost of these things. It doesn't just sort of happen. And this attorney said, he said, well, he says, businesses always say that. He said, but they adjust. So I think it'll be okay. I'm pretty sure he's never worked for one, but that was his opinion. So I want to just mention the individual mandate. I'm getting close to the end here. Yes, sir.
Quick question. You have a wife and 2 kids, you said, yes?
Correct.
Okay, so let's pretend you're working for me, and your wife is working here, okay? That here has to offer her insurance, and I have to offer you insurance. True?
True.
Okay. You elect to have a family plan. How does that work? Who pays for the kids?
It's a good question, and I don't have clarity on that one yet.
In other words, nobody knows the answer to that now, right?
That's exactly right, and that's a really good point. What if let's just take that a step further. What if I work?
Your wife goes into the exchange.
It qualifies for a subsidy.
Right.
Or how about I work 2 jobs? What if I work 30 hours for you and 30 hours for you? And I don't have clarity on those, but obviously these are the things that they're going to have to flesh out. I want to point something out. So the whole point of the individual mandate is so that people don't wait until they're sick to buy insurance, right? If you're going to, one of the things that this law does is it says to insurance companies, it imposes 2 restrictions or 2 regulations that Maine already lives with today. One is called guarantee issue and the other is called community rating. Those familiar terms? Guarantee issue basically says, if I'm an insurance company, you apply for coverage, I gotta give it to you. It's guaranteed that I issue you a policy. Community rating requires me to basically, the pure community rating would mean we all pay the same premium regardless of our age, for example. We have what's called modified community rating in Maine. We're restricted, we don't all pay the same rate, but we're restricted as to how much we can vary the rate from a young person to an old person. And those two things combined are pretty painful for an insurance company. I mean, if you think about if you're the insurance company, okay, I can't really charge somebody based on what their risk is, nor can I say no to somebody if they just had a cancer diagnosis, never had an insurance policy before, but then come in to want to buy one. And I can't exclude pre-existing conditions, by the way, as well. So if everyone just waits and buys when they're sick, then the whole thing blows up. So to make sure that doesn't happen, they say everyone's got to have a policy. That's why the individual mandate is in the law. That's the purpose of it. The question I have is, will it work? Now, it's been a little while since I was 20-something, but if you can go back and imagine being in your early 20s, now I should probably say 27, because we can stay on our mom and dad's plan to age 26 now. But let's say I'm past that age, can't stay on mom and dad's plan, but I'm healthy, I'm still invincible, I don't remember when I stopped being invincible. I think it was when I had a child. But let's just say I'm still invincible. And you tell me, hey, look, pal, you got to buy an insurance plan. And by the way, you got to buy an insurance plan that meets the minimum requirements. Let's say that that's going to cost me $3,000 or $4,000 a year. I'm probably in the ballpark. And if you don't, you're going to pay a fine. And that fine's going to start off at $95 a year. I mean, what are you going to do? How many people of those are going to say, well, 4,000, 95, okay, no brainer. I'm paying 95 bucks, I'll roll the dice, and if I get sick, I'll just go get the policy, you gotta give it to me. You can't exclude pre-existing conditions. It's important to think about that, because the other thing that happened with the Supreme Court ruling was that they said, the other way we get more people covered is we expand Medicaid. Well, the way the law worked, it basically said, look, states, you better expand Medicaid. If you don't, we're gonna pull all your Medicaid funding. And the Supreme Court upheld the individual mandate, the requirement that we have to buy coverage, but what they did do for the Medicaid is they said, hey, wait a minute, that's coercive. You can't do that. You can't tell a state, it's at the risk of you losing all of your Medicaid funding. You can condition new money on that expansion, but you can't threaten the old money. So what that really means is that the states have a choice. Do I want to expand Medicaid? Do I not want to expand Medicaid? Maine hasn't made, they haven't formally made a decision through the governor's office, but yet you may recall that we have an administration who's been trying pretty hard to actually roll back some of the Medicaid provisions in Maine. So if I just had to throw a guess against the wall, I'm thinking they're probably not jumping up and down to expand Medicaid. Well, what happens if they don't? Or what happens if these individual mandates, if people still choose to pay the penalties, which I think some of them, realistically probably will? Well, I'm not going to tell you what will happen. I'm going to put it into Ginsburg's words. So the Supreme Court decision was actually an interesting read. And I should hesitate there because I'm not sure what it says about me that I've actually read it. But when you read it, you've got the majority decision, then you've got all these sort of dissenting or concurring opinions from the different justices. Now, for those of you who aren't familiar, Ginsburg is one of the Supreme Court justices, and she is arguably the most liberal of the Supreme Court justices. And she and her, it was hard, I don't know if I could describe her decision as dissenting or concurring, because she sort of agreed in some respects and didn't in other. But this was specific, I pulled this from her decision. And Maine got mentioned, which was kind of nice. And as you can see, it says, in the 1990s, several states, including New Jersey, New York, New Jersey, Washington, Kentucky, Maine, New Hampshire, and Vermont enacted guarantee-issued community rating laws without requiring universal acquisition of insurance coverage. This was all about her saying, hey, this is why this individual mandate is so important, we have to uphold it. The results were disastrous. So I just throw that out there because it's going to be really, really interesting to see how this rolls out and how this really impacts us over the long term. I mean, you've got some decisions as employers to make right now, but we all pay for this in some form or fashion. So is it going to actually work to get the job done is a whole nother question in and of itself. And I think a lot of that is going to remain to be seen. I want to point out just one other thing before I close. When you think about what we actually need to do to get our health insurance costs down, you know, health insurance reflects healthcare costs. It's just a reflection. Health insurance is a way of financing healthcare costs. And if healthcare costs do this, so will insurance rates. And that's exactly what's been happening. Healthcare costs have been trending up nationally 12% per year on average. If you've ever sat with a financial planner, you know, trying to invest for your retirement plan, 12% is a number that gets thrown around a lot because they say, hey, if you could just get a 12% return on your investment, you'll double your investment every 5 years. So just let's put that in the reverse. If you're getting a 12% on average annual increase on your health insurance plan, if you try not to change your benefits, your cost to provide that coverage will double every 5 years with a 12% trend increase. That's happening and continuing to happen, and we haven't done anything yet to address that. And there's two, I think, critical things that need to happen to start pushing in that direction. And I'm hopeful that all of this attention on healthcare and the healthcare reform law will get us ultimately focused on that root issue. One is transparency. And I think, you know, I think probably everyone in the room knows this, but health insurance cost of services is all over the board. The variation is just mind-boggling, not just in Maine, but throughout the country. And the quality is mind-boggling, the variation. You can get the same service over here, totally different prices, totally different outcomes. You never really know as a consumer. We actually have learned that if you get an MRI, I mean, on the low end, you might spend a few $1,000s for an MRI in the state of Maine. On the high end, you'll spend over $4,000. But there are places in Maine, one hospital I'm thinking of right now, that the amount you pay for the charge that you receive for that MRI is dependent on the time of day you walk in and get it done. A difference of over $1,500, depending on the time of day. Now, you don't know that, and I don't know that when I go in to get that MRI. You know, as deductibles go up, it matters to me, because half the time I'm paying for it. It's not just some nameless insurance company. And even when it is a nameless insurance company, I'm still paying for it in some form or fashion. We have absolutely got to get some transparency around the cost of these services. It is just critical that that happens. And the other main thing that needs to change is our payment structure. Where else in the economy do we pay people more for messing up? And I'm not just trying to beat up hospitals, but it's just the way the system works. It's what we call fee for service. My doc gets paid when he sees me and does things to me. Orders tests, for example. We do infinitely more tests, MRIs, scans, all those things in this country than anywhere else on the planet with no real noticeable benefit to our overall health. But the payment system drives it. If I go in and I have knee surgery and my surgeon botches it, and I'm back in on the operating table getting the surgery fixed, if you will, then my surgeon actually makes more in that scenario because I've gone in twice. I mean, it's amazing. If you sell a product that's defective, when your customer comes back in, is your expectation that they're going to pay again for you to give them the right one? I mean, it's just the only place in our economy where we see that sort of disincentive or misaligned incentives. And employers, I think, are smack dab in the middle of this very dysfunctional system because we, quite frankly, pay the bills. We don't control it, per se, but we pay the bills. So I just want to point out to you that there are steps that absolutely still need to be taken, regardless of what happens with the health reform law, national or state. The main underlying core problems are yet to be solved. I will stop there. I'm happy to take questions.
Joel, I have one on the one of the slides back where the fine for employees was $2,000 if you don't. So if you have a business and you're not going to offer them any medical in that, is that 2013 or 2014?
Right.
Is that a one-time fine? Or is it that $2,000 annually? Is it so? It's a one-time.
My understanding is that it's annual, so it's basically each year it gets evaluated.
So it's a disincentive for the employee then to even offer the insurance in some cases. I mean, you'd be better off to pay the $2,000 fine in most cases, given what rates are.
I think it could be, and I actually did an analysis on that early on, and just took a couple real clients that we had and just modeled it and figured out, what are they paying right now, and how would this translate? And in both cases, it was more affordable for them to pay the fine. I actually took that down and showed Senator Snow and Collins. This is when the law was still being debated, and it was one of those moments where I'm thinking, geez, I better be careful. In the back of my mind, I'm thinking, you point this out. I wanted to point out to say, hey, look, this is troubling. This could create the exact opposite of what you're trying to accomplish here. My point was to say, lighten up a little bit. Give them a little bit more flexibility at the employer level. Don't force them into this decision because, this person's going to have to make it. My fear was that the solution would not be to lighten up a little bit on the employers, that it might be, well, let's just raise that fine, then we won't have that. I don't know where
Would the $2,000 fine per employee apply to just full-time employees, not including the part-time?
that's correct.
Okay.
Yeah.
Or full-time equivalent.
Minus the first 30, you're right.
Or would that be the full-time equivalent?
Yeah, I think it's full-time, but I'd have to go back and double check the regs on that one. I think the full-time equivalents just go into determining if you're 50. I don't think they translate to the fines because they're not technically someone you have to offer the benefit to.
Does the Affordable Care Act deal with or have any provisions for long-term care?
They had one. It was, do you remember the name of it? It was the.
Oh, the Class Act.
Thank you. It was the Class Act, and it was actually a new government sponsored long-term care program. It was actuarially unsound. That actually is one of the very few provisions of the ACA that's already been fully repealed. They basically figured out they couldn't do it.
So here we're coming to the end of 2012. 2014, it looks like, from what I'm hearing here in the 20 years or so, that a huge number of businesses will probably elect to take that fine. That will put those people in their workforce on the exchange. But there is an exchange. So in the remaining amount of time between now and when this is all coming about, what is the possibility that there will in fact be some place for these people to go when it's time?
I think slim. And that's a really good point. So everything I've talked about revolves around people going to this exchange. Well, the way that the law deals with exchanges, it basically says to states, hey, go set these exchanges up. Here are sort of the parameters to the extent that they're defined, which they're not all. We'll give you money. There's grants available to go set these exchanges up. If you don't, we're going to come in and do it for you. The feds are going to do it for you. So it was a sort of a dictate to the states to do it with the threat that the feds would do it if they don't. Something surprising, I think, happened because I think many of them who wrote the law thought, well, of course the states will do it. Just the threat of the feds coming in and do it would be enough to get them to do it. But that hasn't happened. Actually, the majority of states right now have not taken action to establish an exchange, Maine being one of them. And I think what ended up happening is they started really looking at this and saying, okay, do we really want to go through this? I mean, it's complicated, it's an expense, there's a lot that goes into establishing these exchanges, and if you take our administration, which is particularly enamored with this law, they, were part of the lawsuit to fight against it, and do we really want to do it? And they're also, as people start digging into the law, it's messy. They call it sausage making for a reason. And in most cases, laws, they sort of go through one house of Congress and go through the other. A lot of times what they come up with looks different than they get together, make it all into one bill, and then the president signs it. Well, with this law, if you remember what happened, it moved through the Senate, moved through the House, very different laws, very different bills. Before they could get together and work it out, if you will, Ted Kennedy died. And it's important because, not because he died, but because of who replaced him, which was Scott Brown, who was a Republican and took his seat. So suddenly they didn't have the votes to get together and work it out. So they took the Senate bill and sort of moved it through, it was a parliamentary procedural path. They used what's called reconciliation. But what that means is they didn't have time to go through and sort of work out the details of the bill like they normally would. And as you can imagine, 3,000 pages, there's all kinds of stuff in there, that technical issues that need to be corrected. Well, there's a couple specific ones. The Fed's going to do the exchanges if the states don't. They didn't actually appropriate the money for the Feds to do it. One minor problem. And they also didn't grant the federal authorities, exchanges, the same authorities that the state exchanges have. So there's a huge uphill battle for the Feds to do it. Will they be ready in time for 2014? I would be surprised. So what I think may end up happening is, we keep talking about January 1, 2014. I think, again, if Romney gets in, everything changes. If Obama stays in, things probably still change to a certain extent, because now we're going to have to sort of, deal with the reality. Do we have enough time? Will those deadlines have to be extended? Will some things have to be tweaked? Realistically, that's going to happen. I think you may see some of these requirements for 2014 pushed back a little bit. I don't know that for sure. They might scramble and somehow figure out how to make it happen. But I think realistically, there's a pretty good likelihood that they won't.
So we can forget about all this.
On that point, I represent the ski industry. We just had a national conference, so we had people from across the country on this very subject on Friday. But the attorneys there were all very, they feel that if Romney's elected, this will still move forward. They found there was going to be no real legal basis to repeal it. Everybody don't think this is not going to go into effect. So just the point that here we, once again, 2 different conferences, 3 different days, 180-degree perspective on this.
Well, and the other thing too with Romney, it may, certainly there are provisions that they're going to want to hold on to. There's things people like keeping your kids on at 26, and I think that those things will stay. But it matters a lot even just in the regulations. So if so much of this law that translates through the regulations to what you have to deal with, there's a big difference between Sebelius writing those regulations and whoever Romney might put in that seat. So it's still a very different end result, no matter which path either of those take. But you're right, it may not go away entirely under Romney. And a lot of that depends on what happens with the, if he wants to fully repeal it, realistically, he has to win, and the Republicans have to take over the Senate and maintain the House. Is that realistic? I don't know.
You still need a supermajority to do that.
Yeah, to fully repeal it, yeah.
Right, so I think that's,
Yeah. But they can delay effective dates, they can stop funding. There's a ton of stuff they can do to push this back and take it out of your hair for a little while. We'll see what
None of
happens.
the political things are going to answer the funding problem, okay? So if, at the end of the day, you're going to mandate everyone to have insurance, somebody has to pay for it. If we pay a $2,000 fine, excellent, right? But what insurance is there that costs $2,000 a year?
There isn't, by the way, in order to qualify for a subsidy as an individual, there are different actuarial values I mentioned. There's bronze, silver, gold, and platinum. You have to have at least a silver plan, so you can't even get the least expensive plan and qualify for the subsidy. It's going to force you to the upper level. And the way the subsidies work, it's not, okay, we cover X percent, because it's a sliding scale from 100 to 400% of the federal poverty level. It's not, okay, we cover 100% of the premium and then 90%, 80%. It's not how it works. What it says is, to the individual, your cost share, the portion you pay, will not exceed X percent of your family income, and then that's what scales. So there is no limit as to what the up-end subsidy might actually be, what the underlying cost of that insurance plan. So it's a point well taken. Well, thank you for your time. I appreciate it.